Alan Bryce, 35, penetrating gunshot wound to his shoulder.
Shooting at a supermarket near 123rd. Guy had an AR-15.
You're about to be swamped.
Okay, trauma 1. Let's pull Layla and Roxana to assist.
On it. Roxana, Layla.
Incoming. Male 40s GSW to the abdomen. Walsh. On it. Go with him. Let's go.
Female 62, GSW to both legs.
Okay, keep her moving. Keep her moving.
14-year-old male, single GSW, lower left leg.
I need the ED cleared. Let's move him in there. I need surgery down here now!
Another shooting?
We're getting slammed.
It doesn't end.
I need to take this one up to CT scan for CTA.
Dr. Bloom, we can't get the patient ventilated. You're with me. What's the problem?
The bullet
shattered the scapula, the ribs, and the clavicle.
and dropped the lung. We're having difficulty oxygenating him.
Move. Okay, let's place the chest tube and get him in the OR. Floyd, what is it?
I know him. Heads up! Make a hole. Coming through. Come on, come on, come on. Patient with the GSW to the right thorax here for a thoracotomy with the subsequent vascular and chest wall reconstruction. We're gonna lift on 3. Ready? 1, 2, 3. Wait, that's not...
Extended abduct the right arm.
Dr. Reynolds, arterial catheter. When you're done scrubbing in, we'll be ready to go.
Yeah. Bullets out?
Blood pressure's dropping. Bleeder?
I don't see it. Myocardial infarction?
I was thinking adrenal crisis.
Could be renal. Oh, there.
Like a small dagger.
Yeah.
Hang a unit of blood.
And push calcium chloride to help the clotting. Wait, stop.
Would you rather go for TXA?
Sorry, no. No. Just, push the calcium chloride. Sorry.
Okay. I'm gonna go and grab Dr. Hartman to assist.
Shock, likely anterior wall myocardial infarction.
Sending labs, including troponin and paging cardiology.
Placing central line in case we need pressors.
Okay, use ultrasound guidance.
Don't need it.
Your patient is hypotensive, Dr. Shinwari. That's a tough placement. You're gonna need it.
I actually won't.
Okay, that wasn't a suggestion. I said use ultrasound guidance.
Yes, and I disagreed with your assessment, so I'm doing it my way.
And risk a pneumothorax.
That's always a risk, and you know it, even with ultrasound.
But it is less of a risk. We have the technology for a reason. Use it.
Then you can use it with your patient, but I'm not using it with mine.
Okay, that is it. Dr. Shinwari, step away from the patient.
Quiet. I need to focus.
Layla, this is not what I...
Got it. Hand me the introducer. I trained in Kashmir when the killing of a Hizbul Mujahideen militant caused an uprising, and we had to learn to do every procedure in the dark or during a mortar attack. So all of this technology, all of these crutches, they only get in my way.
Bone fragment lacerated multiple arteries. As soon as I suture one, another bleeder breaks loose. Where the hell's my backup? Lynn? What are you doing here? Where's Hartman?
Hartman, why? I'm here to remove a bullet fragment from the patient's uterus. Is something wrong?
Minimal cavitation.
Just...
Low velocity missile.
Give me a second.
Abdominal cavity free of contamination.
Go ahead and remove the superior parts.
You okay, Floyd?
Pelvis uncompromised. Vascular structure sound.
Standing by for pelvic ultrasound.
Sorry. It's just, Okay, I'm good.
Wheelchair, good heading. Wheelchair, good heading.
This has been one awful week. One mass shooting after another, shooting after another. I don't know how you handled it. This has been one awful week.
There were so many this week. I couldn't keep them all straight in my head. I mean, the nightclub shooting after the high school shooting, and then the warehouse shooting. And Monday was that shooter at the grocery store near my place. I see him around my neighborhood all the time with his wife and his 2 girls. He was just picking up groceries. Just living his life. That could have been you. It could have been me. It's everywhere. I used to feel outrage. You know, I used to think it didn't have to be like this. I mean, we didn't have to live like this. But now, it's like we traded one pandemic in for another.
Here's an idea. Your place tonight.
I wish. But it's not my night.
So we make an exception. Meet you downstairs.
I've been away for so long now, falling on me, from your lips to your belly, to your knees, darling, and your feet, and the spirit that moves them.